Hello friends, welcome to my channel, Dr. Abhinav Kumar MD. Today we are back with another interview of another patient which we have operated a week back. So meet our patient who flew all the way from
Seattle, US.
to Patna, surprisingly, and got operated from us. We are with him 7 days after his head wash following his hair transplant. So welcome sir. So we are conducting a small interview to know about your experiences and your suggestions which can help us grow and which can tell our viewers about nitty-gritties of a hair transplant from a patient's point of view. So how did you find us?
So I was researching online. I always wanted to get my surgery done in India, and I went through a lot of places. Looked at Google reviews, Reddit, and read about a couple of places. I got to know about Dr. Abhinav from my father, who's also a doctor, and then I got in touch with him. He shared with me a lot of information. I went through his past work history, his LinkedIn profile, and also his YouTube channel where he had talked about some of the work he has done and his past interviews. And once I talked to him, he explained to me the process in detail, which gave me confidence.
So you said that you inquired in many clinics. So the first line of contact in any clinic is a marketing consultant.
Yes.
Usually. So marketing consultant basically आपकी photos आपसे लेते हैं और शायद वो अपने डॉक्टर से उसे शेयर करते हैं and then tell you an estimate of the grafts required. I think that is the process which is followed. We have changed this. Whenever a patient connects with us, usually because we do very few surgeries in a month, not more than 5 to 6 in a month, that ensures that all the patients who get connected with us, I get connected personally so that he gets a right idea and he pays fairly for that surgery. Because to estimate the cost of a surgery, we have to estimate a lot of things. His donor which is there and क्या निकल सकता है और क्या होना चाहिए. So, so that's how he connected with us and he got the surgery done from us 1 week back.
Yes.
So how was the overall experience of the surgery, sir?
I think the overall process was really good. I was very comfortable. Doctor met me even one day before. We went through some of the initial briefings and he explained the process to me in detail. And then he also made sure the process was scattered across 3 days and so that it does not put pressure on my body or like in mentally or physically, and everything was done very systematically. The first day did some of the process. Slit making was done on the first day, and then the implantation and the grafting was done on the second and third day, and then I was given like breaks in between where I had lunch. I was made comfortable. So yeah, I think the process.
Recently, death in hair transplant was in news in India. So why did it happen? As per me, it was basically a delayed reaction. You can say anaphylaxis reaction. So when you give anesthesia or you can say do the surgery over a period of 2 to 3 days, you don't overdose. Second thing, you can monitor the patient if there's something is going wrong. So it is very important for a patient to get it done from a qualified person who has done the surgeries in the past, as well as he understands all the nitty-gritties and complications of the surgery. So that is how we do it, and since we do you can say very limited number of surgeries in a month, we are not in a pressure to complete it in 1 day or 1.5 days, so that because there is surgery next day. So today is day 7 of post-op. So do you feel better, clean?
Yeah, I feel a lot better.
So how was those last 7 days after surgery?
So after surgery, the good thing is that I didn't feel any pain. Doctor gave me some prescriptions like how to. The only thing that I had to make sure was like I'm sleeping right. So that was the only thing that you make sure that the recipient area is not being harmed or damaged in any way. Apart from that, I didn't feel any pain in these 7 days. I came today to get a head wash and now I feel really good. The head wash went smoothly and I don't feel any pain right now.
So was your surgeon involved in the surgery? That is me.
Yes. So Dr. Abhinav was thoroughly involved. He was the one who was involved in grafting the hair follicles and was also there when the technicians were implanting the grafts, and he was the one who gave me the anesthesia anesthesia. So he was very mindful that he was constantly asking me that if I'm feeling any pain, making sure that the process is as painless as possible.
So why we are asking this question? Because it's a very common complaint in hair transplant industry that doctor comes initially, draws the hairline, maybe makes some slits, and then he goes away. Then he comes at the end of the surgery, and in between it is totally the technician dependent or junior doctor dependent surgery, so who are not qualified enough to understand the nitty-gritties, or say if there's a change in plan in between the surgery, or there's some complication like patient is feeling heaviness or is not feeling well. These things are very important to ensure patient safety. So even in big clinics now, because they run a multiple chain and they do not less than 20-30 surgeries in a month, it becomes totally impossible for a single doctor or say even a couple of doctors to handle so much of workload. That may give you a lower price surgery, but that will compromise your safety and also can lead to a hushed up job despite having best technicians. So because technician under stress the outcome may vary. So that is the point I asked this question. So how do you think you should choose a clinic?
Well, I think first and foremost the initial step is to look at the doctor, because at the end it's a very big step in someone's life. And also I think looking at the doctor's credibility, his past work experience. So one thing I really liked about Dr. Abhinav is like he shared with me the past surgeries that he has done. So that is one thing, looking at the testimonials, looking at how the past results have looked like, and also talking about like how much the doctor is going to get involved in the surgery. And like apart from looking at the cost, I think not just marketing people, but actually getting to know the doctor and his credentials is the...
So this is whenever you look for a clinic, you should ask who is doing your surgery, and can I talk to him. For them, you are one of them. They may be doing 20-30 surgeries in a month, but if you don't meet him or get an idea about the surgery, and you should also ask him what part of the surgery he will totally do, what part of the surgery he will supervise, because it's a very long surgery of 17 to 18 hours. So one person cannot do the total surgery, and it takes a lot of toll on your body. So it requires a good team, but the team leader, which is the doctor, should be the same person whom you are consulting before the surgery. Yes, there can be junior doctors, there can be assistant, but he is the one who should be doing at least 50-60% of the work, and he should change the plan if needed. He should decide if there's something more is required, or something if you have gone beyond the plan. So that part has to be taken care of, and that is a real time work. So involvement of doctor is becoming a big issue in hair transplant industry, because there's a black market in this field also, where you can say the clinics are running without any certifications, without any doctors. The doctors come on call just like us, and they sign the document and the surgery gets done. And maybe the patient can get the result, maybe it may backfire, but since the money has already been spent, patient won't go to another doctor to the same clinic for improvement if the surgery has gone wrong. So he will consult someone better. So you have to spend it once, and you have to spend it wisely. And I think rather than bargaining on the price with the clinic, it's better to take the bigger picture, holistic picture, and then decide whether that price is suitable for you or not. Because India is a price sensitive market, and people can quote any price to fill the surgical slot.
Yes.
That is, I think. So safety is most important. For safety, doctor's involvement, sterilization, cleanliness, assistants, knowledge, and we have to also thoroughly do a pre-operative checkup, so that his BP, vitals are all stable, because a patient may be a heart patient or diabetic patient, a general patient, but may get something abnormal. So these things are very important. That's why you need an experienced person who should be supervising the surgery, because the surgery lasts for 15, 16, 18 hours. For that period of time, your body is under stress, right?
Yes.
So
yes.
Anything extra which you want to add, sir?
No, I completely agree with you. I think for a surgery like this, it's very important for the patient to feel safe and have confidence in the doctor, and especially when you talk to the doctor himself and you get to know, ask your questions, clarify any kind of doubt you have, and when it gets answered to the doctor, that gives you confidence, and you know that you are in safe hands. So that's very important.
The results in hair transplant comes over a period of 4 to 8 months. So you don't get an immediate result. So if something goes wrong, you won't realize it till the end of 5 to 6 months. So you may feel that a surgery has been done properly, but at the end of 4-5 months, you start realizing that something is wrong or something is amiss. So a qualified doctor is capable of correcting that thing, because he has planned it properly. That is also there. We may miss something in the surgery, or we may underdo something which we should be doing more based on certain limitations, but that can be correct. We can do small mistakes. But if there's a qualified person is missing in the whole plan. He will just do a manual labor monotonous job and just finish it off.
Yeah.
So that is because we are all human beings and every face is different, every head is different, every donor is different, every patient's for physical condition is different, his approach is different, what are his requirements is totally different. Everyone doesn't want the same thing. I think we have fulfilled your expectation till now.
Yes, a good experience.
So thank you, sir. Thank you for flying all the way from Seattle, US, and but you trusted us, and you are our second US patient, so very special to us. And I'm sure that you will get amazing results. Stay connected with us, share
Sure.
our photos, and whenever you come back to Patna, we will surely meet. Thank you, sir.
Thank you.